everyone. Welcome back to the OASIS preparation class. This is Anita Werner again, and my slide doesn't want to advance. There we go. Sorry about that. So this is webinar 6, walking through the ADLs. So we're going to go ahead and hit the key points of what we talked about in the module and give you a good idea of what you should be focusing on when you're studying for the exam. Don't forget you can download your handouts and you can add questions in as we're going along, and we'll take a look at your questions at the end of the webinar then today. So the first concept we talked about in the module was that whole idea of completing an OASIS walk. And that is really, truly so important, because if you don't move the patient around and you just answer based on what they say, chances are you're not going to have the correct responses to some of the questions. And I think that really plays out because many times I could look at an OASIS and I'll see, PT didn't open, and then OT has information about what they assessed a day later, and it's different than what PT had. Or nursing didn't open, and what they've got down does not match what PT had. And when you bring it up, then it's like all of a sudden everybody kind of is able to agree on things. So I think sometimes it's just that people haven't done all of the moving around through the house. Sometimes I know that patients just give us a hard time with that. So you really have to push the patient and talk to them about how important it is that we make sure they're safe in the home. So these concepts listed on the slide really are what you're looking for when you do the walk. But I also want to point out, and someone had a question on the discussion board, I didn't answer it yet, but asking about, trying to study and how to answer test questions. When you get to a question that's looking at any kind of functional concept for a patient, or even things like breathing or medications, because you have to be able to access your medications, think about these points as you read those scenarios. Because if you read a scenario and you say, does this patient sound like they have a good general safety awareness? If they don't, then you know that you don't want to talk about how independent that they are when you're picking an answer to that particular question. Or did they remember their device and did they use it correctly? So if you're reading a scenario and you see that a patient forgot their device, or they were using it in the wrong way, or it was too small for them and wasn't safe, then that's all signs that I'm supposed to be assessing for that, and I need to identify that if my patient can't function safely because of these concepts, I should be scoring them lower, whether I'm out there seeing them in the home or I'm doing a test question. And then impulsive behavior. I think that's a big one, and I probably feel like sometimes that's because patients are trying to demonstrate that they're doing well when they get home and kind of, put on a little bit of a performance for us and show how hard they're working at improving. But that impulsivity and not really taking the time to slow down and be safe does put a person at risk for falls and injury. So that's something to consider when we're looking at what we're assessing as they move through the home. And then those physician activity restrictions, that is huge. And that is actually a question area on the test, whether I'm like doing an actual written test, or if I'm teaching a class and I have a scenario up on the screen and say, what do you think for an answer? So many times people forget to factor in that physician activity restriction. So if a patient took a shower, but they weren't supposed to take a shower because that's what the doctor told them, we want to make sure that we're not answering that they're allowed to take a shower. We would have to show that they needed to do sponge bathing because of that. So are they maintaining any physician restrictions that were put into place? And then that whole concept of what is their actual functional level when it comes to how strong they are right now? Do they have enough endurance to really do an activity safely? And how is their balance? Because all of those things can be impacted in patients who've recently been in an inpatient facility particularly. So we really want to look for that and then determine whether or not that impacts their ability to perform more independently in any of their activities. And then we have those cognitive and psychological or behavioral limitations. We want to factor that into functional issues. Don't focus solely on what a patient can do from a functional perspective. Be sure you look at those other areas that can limit patients' function and safety. And then, are they experiencing any dyspnea, and with what level of exertion? When we have to answer M1400, if we don't ever see them exert themselves, we really don't know what it takes for them to become dyspneic. So we want to be sure we're doing enough with the patient to ascertain what is that level of dyspnea, how much exertion is there necessary for that to occur. And then that whole concept of the home environment. Are there some barriers in place there that are impeding safe function? Today's chart that I looked at was talking about a patient that had a walker that was a standard walker, but it was wider. It probably was a bariatric walker from what I was reading. And they couldn't get through their doorways because they lived in an older home with narrow doorways. And they had a smaller rolling walker on order coming in. But without that, there were some things that they weren't able to safely do because of the lack of a device that actually worked well for them. So we're looking for any kind of barriers in the home, like those narrow doorways, stairs. Does that impede a person's ability to maybe get to the bathroom so they can shower, all those kind of issues. So those are the concepts we want to be thinking about, whether we're out in the home assessing someone, moving them through the area, or if you're taking a test, think about that in regards to any of those questions. So then, once you've done this great assessment, you've figured out here's what they're able to do, here's when they're short of breath, here's when they need assistance in order to remain safe. I have to make sure that as I choose my responses on the OASIS, that I stick to those CMS definitions and the guidance they've provided for us. Because clinically, if we were asked to define some of these concepts like bedbound or chair fast, we might define that a little differently than CMS did. And we may not necessarily automatically intuitively go to the correct answer that is really what CMS is looking for based on the guidance they've provided. But a general concept to focus on is that CMS's goal with the OASIS, or one of their goals, is to determine, is this patient able to take care of themselves? What can they do safely, and how much help do they need in order to do things safely in their home environment? So if you're answering the questions with that concept in mind, you're much more likely to select the correct response. So let's look at some of our functional questions here that we've started with and talk about those key points to think of for each one of these. So with M1800 grooming, we have that whole idea again of look at all of the factors. Grooming, there's a lot of steps in grooming, all the things they've specifically stated that they want to have included here. So maybe endurance is an issue. It could be that environment is an issue. They can't get to the area where grooming needs to take place, or they need assistance to get there. And then cognition can be a factor, whether it's remembering to do the tasks or remembering how to do the tasks. And then emotional state, because depression and anxiety, things like that, can factor into whether or not a patient can groom independently. So take all of those points under consideration. Now, as we look at our responses of 0 through 3, remember with 3, whether we're looking here at grooming or we're looking at M1810 and 1820, the two dressing questions, response 3 is reserved for those people that can't meaningfully participate in the process. So they can't participate in grooming in a meaningful way. So that's going to be reserved for those folks. Now, when we look at response 1, remember too that it's not just that whole idea of utensils have to be placed within reach. It also includes the idea that if I have to get that patient to the area where all of the grooming supplies are, they need assistance for that, then response 1 is the correct choice if they don't need help to do the actual grooming. So response 1 is saying they just need help getting to where they need to be, where response 2 is saying, no, they actually need help with the tasks of grooming. So that's where we have that little delineation. Now, if we look at oral hygiene in our GG0130 item, here we have just one component really of M1800 that we're assessing. So with this, keep in mind that if they need to have someone put supplies within reach or go retrieve them and take them to the patient, then response 5, setup or cleanup assistance, is going to be what we want to select. Now, there is specific guidance just for this particular item for B, oral hygiene, that getting to the area where grooming takes place, or where oral hygiene takes place, is not something you're supposed to factor into the response. So that's a little different than what we have with the grooming question, where we would factor in that ability to get to the bathroom and brush their teeth, for example. So supplies being retrieved, put out for the patient, reaching something in a cabinet in the bathroom that's too high, all of that is response 5, setup or cleanup assistance, if they're able to independently do their oral hygiene once we do that retrieval for them. And this is one of those questions where we may be answering it just based on report from the patient or the caregiver, because we don't necessarily get to see them do all of their oral hygiene while we're in the home. Most of the time, that's probably not going to take place. And I would not anticipate that you would make all of your patients take their dentures in and out and do all the cleaning. So we can use caregiver report. Obviously, we want to balance that with what we've observed them doing in other situations. What's their dexterity like? What's their endurance like? Anything else you need to factor into it to select their response. So if you see that this patient maybe is going to need some help with this, but they're telling you they're independent, it's okay to answer it based on what you've figured out about the person from assessing other areas, and use that information to determine your response to be oral hygiene. So next we have 1810 and 1820 are two dressing questions. So again, we have that response 3 that's just talking about those folks that can't meaningfully participate in dressing. There's really not any steps of the process they're able to manage themselves. Someone else has to do it all for them. So with dressing, we have a few different things we need to be looking at. Are they able to retrieve their clothing from where it's stored? And that's from its usual storage place. So if somebody temporarily has, moved things around for them, but it's not their usual storage space, that doesn't count. So they have to be able to retrieve it from where it usually would be found. And then think about what their usual style of clothing is to wear. Here's a perfect example. My mother's going to get her shoulder replaced, and she's thinking ahead. So she's thinking about, I'm going to go buy more button-down shirts where I can slide my surgical arm in easily, then put the other side on, and I'll be able to dress more simply that way. And she doesn't normally wear button-down shirts like that. She's thinking about going and buying a coat that's 2 sizes bigger so that she can put her coat on more easily. So those are not her usual styles of clothing. So I would want to still be answering based on how much help does she need with what she would normally wear. Pain, cognition, psychological conditions, all of those things could impact dressing, so factor those in too. And remember with 1810 and 1820, and actually also back with grooming, we have that concept of the majority of the more frequently performed tasks, or the more frequently worn clothing items, the more frequently performed dressing activities. Those things are what you want to be answering based on. So if a patient is independent with some things, but they need a lot more help with others, I'm going to be looking at the majority of the more frequently performed tasks or clothing items that they wear and answer based on that. And don't forget, we can count those non-clothing items that are put on sort of like a dressing process might be, like putting on a brace or putting on a prosthetic or things of that nature. The boots after they have a fracture and they need a boot on their ankle, for example. So all of those types of items are part of the dressing process. We do want to capture that based on whether it's upper body or lower body in 1810 or 1820. So looking at 1810 and 20, we have response 2, that idea of someone has to help the patient to put on either their upper or lower body clothing safely. So don't forget, like we've talked about in the past, help from another person is very broad. It could be cueing or supervision, or it might be I need to just be standing by to help them, or I have to have some light touching assistance, that contact guard assistance, or maybe I have to directly assist them with a portion of the dressing process. So if they need help with the majority of their dressing, all the different tasks or clothing items, then I'm going to say response 2 will apply. If they can do almost everything and I only have to help them with one thing, then I'm going to be saying, well, no, that's not the majority. And I would either answer 0, that they're totally independent, or 1, if they were independent once I retrieved items. Then I do have my choice of 1. So with 1, I'm saying my patient is totally safe with their dressing, whether I'm talking upper or lower body. It's just a matter of retrieving items for them. Once I have it within reach of that patient, now they're able to independently dress themselves, and I'm not concerned for their safety or their abilities in that situation. And if I'm going to choose response 0, now I'm saying this patient doesn't need anything. I don't have to remind them. I don't have to cue them. No one needs to be supervising. They are totally safe and independent with the process. They can take care of all of it. Now, in our GG0130 items, we have it split out a little differently because we have F, upper body dressing. So here we're looking at basically identical abilities as to what we assessed in M1810. It's just the guidance is a little different here, and this is an important difference because we want to remember that while the M1800 items, we're talking about the idea of the majority of dressing tasks. Here, our answers are based on their ability to perform all upper body dressing tasks, not the majority. So if they need to put on 3 pieces of clothing, then I'm saying, well, how much help do they need to get that done? Do they need someone to do most of it, but they can participate? Well, then I'm going to have to say that the caregiver does more than half of the effort. If they can do more than half of it, then I'm going to say the patient does more than half the effort, the caregiver does less than half. So I'm looking at that whole combination of everything involved for dressing and answering based on that as a whole package, not splitting it out to certain activities done more often or certain clothing that's put on and, majority. That doesn't apply with these GG items. And then with lower body dressing, the key thing to remember here is we've split out footwear from lower body dressing. It's not like M1820. So here, I'm not going to include regular footwear, and I also don't want to include any kind of compression hose. So any of your Ted hose or Jope stockings, anything like that. If it's covering any portion of the foot or all of the foot, it's supposed to be considered part of footwear, even if it goes all the way up the leg. So that's a concept to keep in mind there. And again, we're going to answer based on that ability to perform all of those lower body dressing tasks and not the majority. So then finally, in our matchup of our dressing here, we have GG0130H, which is the putting on and taking off of footwear. So they're going to have you looking at all of the footwear and how much help do they need for all of that. And we're going to remember to put our compression stockings here. And we're talking about the footwear that a patient usually wears. Now, interestingly, I don't have it here, but there is Q&A that talks about safe footwear. So if a patient's putting on footwear and taking it off, but it's not safe, maybe they're putting on flip-flops and they're diabetic and that's not safe for them, then you maybe can't answer this question because they don't actually put on footwear that's safe ever. They don't even own it. Or maybe they're putting those flip-flops on because they can't put on their diabetic socks and shoes. So you have to be looking for those kinds of concepts with this too. All right, let's move into bathing next. So with M1830, remember we have this kind of split out here looking at different types of bathing situations as far as the location for the first 4 responses, 0, 1, 2, and 3. Those are folks who can get in the shower. There's no reason to keep them out of a shower or tub for bathing purposes. Where with responses 4 and 5, we're now talking about folks who have to bathe outside of the shower, either because of environmental issues or physician restrictions or fear of using the shower. Something is keeping them from using that shower or tub. And response 6 is different because that one applies no matter where the bathing task occurs, because it's just capturing those folks who can't participate in bathing. So as we assess bathing abilities, don't forget those key concepts that really aren't part of the actual bathing so much. It's things like getting to and from the shower. That counts. So sometimes that's a matter of going up and down stairs, or it might be a matter of a person just needs help all the time ambulating or supervision all the time. So to get to and from the shower, they need supervision, then that's automatically response 2 or higher for that. And then safely transferring in and out of the shower. Sometimes people have showers that have a great setup with all the right safety equipment, but they don't use it correctly. So we really want to be seeing what is it they're actually able to do? What are they actually doing in this bathroom when it comes to taking a shower? And then, do they have some kind of issue that we've identified with that balance or endurance? Because if you have people with balance or endurance issues and they don't have a seat of some kind in their shower bathing setup, that's a concern for safety, because especially after someone has been ill or injured or something, they may need that seat in order to be safe and unsupervised while bathing, where if they don't have that, we might need to say they need supervision at all times during bathing just because of concerns about balance or endurance. Or it might be that we're so concerned we say, no, they can't even do their bathing, taking a shower, or getting into a tub. We have to make sure they sponge bathe. And then, of course, if the physician's stating no showers or baths, that means we cannot mark 0, 1, 2, or 3, no matter what the patient is doing. So if they've taken 10 showers since they got home, that doesn't matter because the physician said they're not supposed to. And part of physician restrictions is kind of considered a safety component. The physician restricted them for a reason. They need to follow that restriction, and we need to answer based on that. So when we look at that bathing question too, keep in mind that you might need to perform that shower transfer with someone if you need to figure out, well, how are they able to get in and out of the tub or in and out of the shower, especially if they're telling you they're taking a sponge bath and they're just doing that by choice, not because they need to for some reason. It's just their personal preference. And as we answer M1830, there's some things we want to exclude from this. And it gets tricky because of M1830 bathing looking very different than our GG0130 bathing question. So in M1830, we don't want to talk about them gathering supplies. So it's kind of counterintuitive, I think, because we're talking about their ability to get to and from the shower, but we're not talking about their ability to gather supplies. We don't want to talk about them washing their hands, face, or hair because that's not assessed here, and drying off is not assessed here. And I mentioned a little earlier that piece of fear of falling that is a barrier to using a shower or tub for some patients. So if you have that patient that truly does have that fear in place, it may be that you could mark sponge bathing simply because of that fear concern. Even if they perhaps could do it functionally from a physical perspective, it's okay if that anxiety or fear is keeping them from doing it and you mark sponge bathing in that situation. And then we do have the Q&A about patients who need help to cover a dressing that might be on them or a wound of some type. If they need that help, then we have to be marking 2, 3, 4, 5, or 6, somewhere down the line there. We can't choose response 0 or 1 for those folks. So let's run through our choices for bathing here in M1830. So with 6, we're saying they can't effectively participate in bathing. That means they just totally really can't. I mean, they can sit there and they maybe can hold something for you, but that's the extent of it. They can't actually do any washing. So that's our patient, and we're going to capture them under response 6, whether we are putting them into the shower and washing them off in the shower, or putting them into a tub and doing the bath for them in there, or if they're getting sponge bathed in wherever place in the house, whether it's the bathroom, the bed, any old spot. So it's just that situation where someone can't participate, automatically you select response 6. Now to move up to 5, now I've got that person who can't use the shower. So they're participating in bathing, but they're not going to be able to use a shower or tub. So it might be that they don't have a working shower, or perhaps they can't get to where their shower is located. And it might be, too, that there's a physician restriction that prevents showering. And then, of course, we have the fear concern, so if they're afraid to use the shower. And in any of these situations, you've got that patient that has to sponge bathe, and this person needs some help to sponge bathe. That's why we're selecting response 5 versus choosing response 4, because it's really the exact same person. It's just that with response 4, I'm indicating I have no concerns about them doing their sponge bathing totally independently. I don't even need to be in the home. They don't need any cues, supervision, assistance of any kind to be safe in sponge bathing. Now, once they are able to use the shower, then I'm moving up to response 3. So I'm saying by choosing this response that my patient doesn't have any physician restrictions. They can use the shower safely. So that means they can get to it. They can transfer in and out. And they have to have a person with them at all times throughout the showering process. And they're still able to participate in showering because, of course, otherwise we would move them down to response 6. Then we move up to response 2. So we're basically looking at the same type of patient. It's just here I'm saying, well, this person doesn't need me there present the entire time for bathing. They need intermittent assistance of some kind. So it could even be that I don't need to be there during the actual washing process. It might be just that I have to help them transfer in and out, or I might just need to help cover a dressing. But this person can participate in showering, and they don't need a human being there with them throughout the entire process. If they need that process of having help the whole time, then I go to response 3. Now, moving up to response 1, I've now got that person where I am saying, hey, this person is so darn independent that as long as they have a device of some kind, they're totally safe to do their bathing in the shower or the tub. They don't need me in the home. They don't need any help whatsoever from me. And then a 0, of course, is saying they can do all that without even having a device. So let's look at how that compares to GG0130E. So here, when I'm assessing showering and bathing, really, when you go to answer a test question, or even if you're answering this out there in the real world, I suggest reading this one, because it really does, if you follow exactly what it says, it keeps you from considering things that don't belong here. So it's just that ability to bathe themselves, which includes washing and rinsing and drying off, but not washing the back and not washing the hair. It's not including transferring in and out of the tub or shower. So we're going to wash, rinse, and dry off. That's it for this particular one. So that means that I could have a patient that cannot use the shower or the tub, and I'm going to have to score them pretty low down the chain in M1830. I'm going to be marking a 4 or a 5 for them. But over here, I could say that they're actually independent in this process because they can wash, rinse, and dry off. Maybe they just couldn't get to where the shower is, and that's why I had to select response 4 or 5 response 4 in M1830. So put the pieces together and realize that things are not going to match up neatly between M1830 and GG0130E. Now, if your patient does need some kind of help before or after the bathing process, so not in the middle of it, once they start bathing, if help has to occur after that, that is not setup or cleanup. It has to be something that can only be done before or after. So sometimes patients need to have their basin refilled if they're washing out of a basin. That's considered happening during the process, so we would not use response 5. Instead, we'd have to say, well, how much help did I have to provide that patient? Did they still do more than half of it? If so, then I'm going to mark response 3 for that. Otherwise, I would mark response 2 because I had to do something to help them. Now, an inability to shower, remember, don't mark O1 dependent here because we're still just looking at how much help do they need to sponge bathe safely. Don't think about that whole shower thing. Okay. Next, we have toilet transferring. So with M1840, keep in mind, this is that 2-part question that's looking at both can they get to and from the toilet or the bedside commode, and can they transfer on and off of the toilet or the bedside commode. So when you're answering the question, think about M1860. Think about what you saw as they moved through the home. Did you see them able to really walk around independently? Because if they can't get to where their toilet is, or even maybe to their bedside commode, then that means you can't mark 0 because they have to be able to do that independently. Instead, you would need to select response 1. Same thing with the transfer process. If you're seeing that they have balance issues when you're assessing someone, then that might be a clue that they're going to need some help with transferring on and off the toilet. You're going to want to assess that and make sure you're putting all those parts together to paint that picture of a patient that makes sense, where you're showing it all fits together correctly. So as I look at 1840, I want to be sure I don't include things that don't belong there, like the toileting hygiene. We'll leave that for M1845, and managing clothing, also M1845. And if they are using a bedside commode or a bedpan or a urinal, I don't want to think about their ability to empty that, because that's not part of what CMS wants us to assess in M1840. Now, if they're using a bedside commode, we need to figure out, is it simply because they don't have a caregiver available to assist them to get to the bathroom, or is it because they truly need to use a bedside commode? So if it's more of a question of having a caregiver, well, then I need to step in and be that caregiver and see how much help do they need to get to and from and to transfer on and off. So I'm that surrogate caregiver, because I don't want to say they need a bedside commode if the only reason they truly need it is because someone isn't there to assist them. And then when I have that patient that's using diapers, or if they're someone who just chooses to be incontinent and not get up, all those kind of situations, I'm going to talk about, well, what can this patient safely do? So sometimes people do use diapers because they're not safe to get up at night, or they're not safe to get up at any point in time. In that case, then I'm going to score them that way. But if I find they really could get to and from the bathroom and transfer on and off with help, then I want to capture them as 1 because they can do it with assistance. Now, if we have a chair-bound patient, remember you need to be certain that that person is actually able to meaningfully participate in the process of getting to and from and transferring on and off. So somebody that's being moved in a wheelchair or with a Hoyer lift and they're not really participating in any of this, I can't say that they got to and from the toilet and transferred on and off since they didn't participate. So let's move through those 1840 responses from the bottom. So with 4, totally dependent on toileting, if I'm going to be selecting that, it could mean one of these things here. It's my patient can't meaningfully participate in the toilet transfers or getting to and from the toilet like we just described. Or it could be that they can't get to and from the toilet, but they can transfer on and off. Or they can't transfer on and off, but they can get to and from. You have to be able to do both of those. And if you didn't have a bedside commode, a bedpan, or a urinal that they could use, then I would have to say 4, totally dependent. Because if you can't get to the bathroom or get to the bedside commode, that means I only have the option of a bedpan or urinal, or response 4, totally dependent. So I'm also looking at what equipment is actually there, because I never want to say, for example, that they could use a bedside commode if they don't have one there, because how do I know they're going to use it safely if it's not there for me to assess them? Okay, so moving to response 3, this is a response that really I don't think applies to very many of our patients, because we're saying they can't use the toilet, they can't use the bedside commode, but they are able to use a urinal or bedpan independently. And if they're male, they can use both of those independently and safely. So that's a lot to ask from a patient, to be able to do that independently and safely. But if you do get a patient who is able to do so, then you can select response 3. Moving up to response 2, now we've got that person that isn't able to use the bathroom facilities, but they do have a bedside commode and they can use it safely. Maybe they do that independently, maybe they do it with help from someone else, but the 2 points are they've got that bedside commode and it can be used safely. So that's what we're looking for response 2. Moving to response 1, now I do have a person who is safe with transferring on and off of the toilet and getting to and from the toilet, but they need some kind of assistance at some point or throughout all of that for that to happen in a safe way. They're meaningfully participating, but they just need another person to participate with them at some point or throughout the entire event. So now let's talk about how that compares to GG0170F, the toilet transfer question. So this one, again, is kind of different than what we just had with our M1840, excuse me. So we're excluding that ability to get to and from the toilet. We're also excluding the toileting hygiene and management of clothing, just like we did with the other question. But the thing is, if they're not using a toilet or a bedside commode, then we have to use a not attempted code here, because this does not look at whether they're using bedpans or urinals, or if maybe they're wearing a diaper or they're just incontinent with a pad underneath them. This is only looking at, can they get on and off of a toilet or a bedside commode? We don't have to think about whether they can get to and from a bathroom, anything like that. It's just that simple minor task here of getting on and off. So code 909, not applicable, that's what I want to use if they couldn't get on and off of a toilet or commode before they had this illness, injury, or exacerbation, and they still can't do it now. Whereas 88 is going to apply if I've got someone who could do that previously, but now they can't because of their illness, injury, or exacerbation. So it's a difference of what could you do before that changes how you would answer if you're using one of those not performed codes. Now for M1845, toilet hygiene, when we look at this, this is another one that has that option 3 that's saying the patient depends entirely upon another person to maintain toileting hygiene. So they're not meaningfully participating in clothing management or the toileting hygiene. And this is one of those questions that covers a lot of territory, because we're looking at maintaining hygiene, adjusting clothing safely, and then if they have incontinence pads or diapers, can they manage that safely too? So answering M1845, I have to think a little bit about, am I painting a picture here in this question that matches the picture I painted in some of my other items? So for example, in M1820, my lower body dressing, if I gave response 2 or 3 as an answer, then I'm saying that they're not independent in managing their lower body dressing. So I need to think about, well, what about here with toileting hygiene? Maybe they are independent for toileting hygiene purposes, because I just said they needed help because of a lot of other things in M1820, like a person might need help with their socks and their shoes and their brace and their AFO, and therefore they needed help with the majority of things. I had to say that for M1820. But here, they're able to slide their pants down and slide them back up, and they always wear elastic waistbands, so it's no problem for them. So it may not always correlate, but I want to be thinking about it. What did I say about that lower body dressing when I think about toileting hygiene, since it does include clothing management? And with M1860, I want to be thinking about, did I say they could move around? Because if they're going to need help to retrieve supplies, I want to be reflecting that here. So I'm thinking about it not just from the perspective of the actual hygiene, but also how are they getting the supplies that they need to perform the hygiene? Some people have everything they need in copious quantities right next to them by the toilet, and they don't have an issue with this. Other patients might need to get to where their supplies are stored, or they only have a little bit of toilet paper here, and where's the rest of it? Oh, I don't know, it's in the basement or something like that. So we're factoring in all those kind of considerations. Now with GG0130C toileting hygiene, this is pretty much identical to what you just assessed in M1845. So obviously we have more response option choices when we get to GG items, but what we say here should very much match up to the person we described in M1845. So it's not going to be a big difference in the response like we have maybe with the bathing question, for example. I'm sure you all have a gold gilded toilet in your house too. Okay, so let's take a look at one of the questions we've received in and talk about that, and then we'll go through whatever questions you've submitted today for us. So in M1820, if I have a patient who needs help only with donning compression stockings, they're independent with their underwear, their pants, and their shoes, would I answer 0 if the patient ambulates indoors independently, and 1 if the patient requires assistance for ambulation and therefore needs clothing retrieved? Because 2, needing assistance to dress, wouldn't be accurate, since donning compression stockings was the only dressing task they couldn't complete. So that is pretty much a correct assessment of the situation, because the compression stockings, if that's the only area where help is needed, it's not going to fit that majority of the more frequently performed tasks convention that we have with our dressing questions in M1810 and 1820. So then next, you got to determine, can they independently retrieve clothing from where it's restored? So response 0 is going to be correct if they could get that clothing safely on their own. But if they need assistance to be sure they're safe, then we're going to go with response 1. But we have to be careful that we don't automatically say, my patient needs help with ambulating, therefore they always need help retrieving grooming items, retrieving clothing, retrieving toileting supplies, because it's not always if this, then that. For example, I could have a patient where their supplies or their clothing are routinely stored within reach of them. So if they always have things in this little cupboard that's right next to their bed and they can safely reach it, and that's where they keep all their clothes, well, then they're safely retrieving it. I also could have a patient that needs help ambulating, but they also have a wheelchair and they wheel themselves over to the closet. They can get all their clothes. They keep it all in the lower rack. They keep all their clothes in the dresser in the lower drawers, and they can get things safely with their wheelchair. So they may not be able to ambulate. However, they can safely retrieve clothing independently. So we want to be not automatically having those things in our head that say, if I did this here, I have to answer it that way over there. Sometimes that works, but many times it could trip you up in certain circumstances. Okay, let me take a look at what questions you've got in here today. Give me one moment to open up my question section here. Okay, so our first question, I believe, is identical to what was posted inside of the discussion board. And in Module 6, someone had a little trouble getting an answer to stick in there. They were having trouble with it, actually taking the response. So if you have a problem with that ever, just let us know and we'll be happy to try to help you with that. There's a question about the rationale for that. So what I'm going to do is I'm going to post that question in the discussion board along with here's the actual correct answer and what the response was. Since they couldn't put the answer in, they weren't able to see what the answer was. Somebody had put in about handouts. They should be available for you now. So if you're not seeing them there, don't forget you can always pull them off of the class page underneath the module information. And then we have a question with dressing upper and lower body. Sorry, hang on, let me open that a little bigger here. If they use a two-handed walker to ambulate safely and have to let go of the walker to retrieve clothing from the drawer or closet, does this make them unsafe in dressing since they are not now using the walker with two hands? I would say that's going to come down to your judgment. What are you seeing there? So for example, you could have, I could tell you, like for me, because I'm kind of lazy, I don't want to walk all the way over to the closet to go get my shoes. So I have all my shoes that I routinely wear lined up right underneath the bed. And my dresser, I can actually reach it from my bed, so I can get to that clothes there. So if I had everything I needed in there, I'm not having to deal with any retrieval issues. But if I had a walker and I needed to go somewhere and I just needed to get a shirt or maybe a pair of pants and I have a walker basket, maybe I can put the clothing in that. So I'm going to have to really assess when I see that patient with the walker, if just taking their hands off the walker to retrieve something makes them unsafe, then yes, they do need help to retrieve items. But it could be that they're able to actually retrieve it. They can take hands off of the walker and then they have a safe way to transport it with the walker. Then I could say that they don't need help retrieving the clothing. So that's a very good question. So that's why you can never say, always this answer applies in this situation, because it really is individual sometimes based on people's environmental setup and their level of function. So that is the only other question I have answered today. You guys had like 100 questions the last two webinars, but this time we just had the 1 or 2 questions. So that's just fine. If you think of more, remember you can put them into the discussion board and I'll get you the responses on there. And the exciting news for you is you have 2 more webinars and you are to the point where you'll be taking your practice test. Now, I had also in that question that I'm going to be answering on the discussion board, there was the idea of how do I study for this test? And do you have any study tips? We are going to be going over that in our last module. I have information and some suggestions for you on that. And then also, like I mentioned at the beginning of today's webinar, take a look at that first slide that talks about what things I'm assessing in my OASIS walk. And then for each one of our particular OASIS items, we were looking at, cognitive issues and this issue and that issue. All of those things, you want to always be checking scenarios for that, because if we're trying to test you on a concept like, are you remembering that if a person needs reminders because of dementia to do something, that counts as assistance? Well, if you read the scenario and you see it says, and the daughter reminds her dad to do this when dressing, that tells you that your answer is not independent. So remember, that's a piece of helping someone out. So you're always looking for those kind of clues as you read a test question, because every question is written in a way to kind of test one of these major concepts, and often they're concepts that are frequently missed. And don't forget too, on your slides from the webinars, you have those little keys in the corner, and that will focus you in on which concepts in particular should I be feeling most secure about when I start taking that test, because there's going to be more of a focus on this type of material. Okay, so that's it for today. I look forward to seeing you next week and on the discussion board. Have a great evening. Take care.